working. Oh, thank you, Celie. Sorry, I didn't realize you stopped it. I am going to be talking slow, and if I end up speeding up because we're running out of time, one of the interpreters please remind me to speak slowly. What else? So I've been with public health since 2001, so for 20 years. Obviously, I've not been working on COVID, but for 20 years, but I have been, actually, it'll be 21 years soon. But I have been working on COVID since the beginning of the pandemic. And I know I always say this spiel, but if you have any questions about anything, prior to the last several weeks, please let me know. There have been so many changes, even in the past several weeks, let alone in the past 2+ years. And that, I think, can really lead to a lot of distrust of our messaging and other, messaging coming out. So if people have questions on why the changes or what, or something else about COVID that's not in this presentation, please ask. I try not to repeat things from previous calls, but I'm also happy to answer questions from previous calls. If you weren't there and you missed it, just ask a question and I will answer it. All right, I'm going to do what Kathleen said and take a breath. Okay, so, wow, that's huge. Today, we're gonna do the usual case count and vaccine count for King County. It's new that booster shots are available for 5 years of age and up, so we're going to talk about that. We're going to talk about vaccine status for 6 to 5-year-olds. And then I included monkeypox in here, even though it is not COVID. I figured I would be getting some questions about it. So I did include some information about monkeypox. Lucky for you all, I did not include any pictures. All right, so starting with the update, first of all, these are some volunteers from one of the Federal Way vaccine events. So I found this picture recently and I just thought it was amazing, and I wanted to thank them and highlight them for all the work they did at the vaccine event. We've had so many volunteers over the past few years that, our rates would be much worse without them. How about that? All right, so I just wanted to highlight them. All right, so we're going to start with our case count. So we're going to start first with where we are with cases and then move into vaccines. Again, please feel free to ask questions. I much prefer engagement. Often people wonder if we'll send this out. So just to tell you, we will send the PowerPoint out. Unfortunately, this one is huge in size, so I will be sending it out as a PDF, but you can still, all the links are live. So you can click on any of the links in the PDF and you'll still be able to get to the information. All right, so we are still at a medium level according to the CDC's rating system of low, medium, and high. And medium rate means that we are surpassing over 200 cases a day per 100,000 residents over a 7-day period. So the good news is that our hospital rates continue to be low. And I'm looking to see if I give more information on that. Yeah, so I'll show you that information. Here's the thing for us to keep in mind is the rates that I'm going to talk about are the rates that we know. We know that a lot of folks are doing home testing right now and not reporting it. I'm hearing a lot from schools that like third of classes are out and yet no one's reporting that their child has COVID. So we know people are not reporting home tests and also not reporting. I know someone whose whole family got COVID because their workplace had 11 cases and their work didn't tell them. So a lot of times things are going to be underreported, and I just want to say that. The other thing I want to say is in this middle number where it says 48% increase, when the numbers are low and going up, sometimes these like percentages are going to look very big. So just look at the numbers instead of the percentages. So again, what we know of cases is we're having about a little over 1,218 cases daily. That's the average. But again, lots of folks are doing home tests. So this is probably pretty incorrect. Our hospital rates are beginning to increase, but again, it's still, the number is still low. It's a 20 people hospitalized because of COVID daily. That's the average. So that's good news. And then around 1 death per day is the average. So again, take the case rate with a grain of salt, but we do know the hospitalizations and death rates. Are there questions about that so far? Okay.
Yeah,
Oh.
there's actually a question in the chat box.
Oh, there is?
A direct question to me.
Yeah.
A couple of weeks ago, we heard that case rates, transmissions were higher in North Seattle and North King County. Do we know if this holds true?
Yep. So you can see here, again, things are change constantly and fluctuate. So you can always go to our dashboard and it'll tell you, and you can actually click on the area. So currently the rates are highest in North Seattle and Shoreline and lowest in Southeast King County. So, and I think that was similar to what we had discussed last time. And if there's a follow-up question, please go ahead and email or send that on over. Cases are increasing about 1%. I'm sorry, decreasing 1% week to week currently. But again, I would take that with a grain of salt. We know we have a lot of cases, and we know that we're not getting the correct picture because of home testing. Rates were highest a month ago amongst 18 to, I think it was like 18 to 30-year-olds, and now they're highest among 30 to 49-year-olds. So these are just trends. The rates seem to be stable, but again, that's only been in the last week, so it's too early to determine if they're going to stay stable. And again, we don't know all of the cases because some people aren't testing and a lot of people are doing home testing. And then BA2 is still currently the most common variant in the county, in the state, and in the country. A reminder, BA2 is extremely contagious because it creates a lot of virus in the body. So the more virus there is, the more contagious the illness will be. And it's even way more contagious than Omicron. Currently with hospitalizations, we have a 4% increase in the week-to-week trend, but in the past week, they've been stable. Emergency room visits and admissions to emergency rooms for COVID-like illnesses have increased in the last week, and the number of hospital beds have remained stable. One question I often get is, are we going, like, with rates going up, are we going to be seeing changes to like the mask mandates or, going back to any mandates? And I don't have a crystal ball, so I have no way of knowing, but my guesstimation currently is that even though the rates have been going up, and they're higher than they were with Delta because our hospital rates and death rates are low, that that's probably one of the reasons we're not seeing any mandates happen. A reminder, the reason that our hospitalization and death rates are low is that I'll show you the rates for vaccines next, but we had about 250,000 more people get vaccinated during Omicron. So we have some of the best vaccination rates in the country. Unfortunately, our booster rates are not as high as we'd like them to be. And then we also saw the highest number we'd seen during this pandemic, the highest number of cases during Omicron. So there's also some natural immunity happening out there. So the vaccines don't necessarily prevent these cases. People can still, especially with these new variants being so contagious, but they are really good at preventing hospitalization, death, and severe illness. So that is probably why we are seeing such low rates of death and hospitalization. All right, questions on any of that? I did that kind of quickly.
Nothing in the chat.
Awesome. Sorry for continually wiping my nose. I have a dog and a cat, and I'm allergic to both. All right, let's look at the vaccination rate. And y'all, please ask questions whenever you got, because it, you know, I want to make sure you're getting what you need from these as well. So, all right. So here's our vaccination rate for the total population. And then I will also show you for people who are actually eligible. So, because folks who are under 5 are not eligible to be vaccinated. So folks who've received at least 1 dose of vaccine is 88.5%. By the way, one of the reasons I read a lot of the slides, I know I'm not assuming that folks can't read these, but I also want to make sure the interpreters are only going to interpret what I say out loud. So I will be reading some of the slides to make sure that folks are getting them in all languages. So people who have received at least 1 dose, 88.5%. I'm going to tell you it is critical for folks to get the 2nd dose. So we are not recommending Johnson & Johnson anymore. So with Moderna and Pfizer, highly imperative to get the 2nd dose in terms of effectiveness rates. People have completed their initial series, so either that 1 dose of Johnson & Johnson or the 2 doses of Moderna and Pfizer, a little over 81%. And then people who are eligible for boosters and have gotten them is a little less than 50%. So that's the current, sorry, that's the whole population. So I said that wrong. People who've received a booster is a little less than 50%. But people who are eligible for boosters and are what we are now calling up to date. So they've done their initial series and they're eligible to be boosted and they've gotten boosted is 55.8%. So that's lower than we would really like it to be because the boosters are going to, especially with these new variants, what we see with the studies is that it is critical that people who are due for their booster get the booster so they can maintain their risk of not getting COVID. It's not the way I wanted to say it, but again, I'm a little frazzled today, sorry. So imperative to get the booster. So first imperative thing, both doses. If somebody is immunocompromised, they want to get a 3rd dose 4 weeks after the first 2 shots. And then for folks who are immunocompromised, they would then also get a booster at 3 months. And folks who are not immunocompromised would get the booster at 5 months. what we see is that the percentage has gone down a little bit from last week to this week around folks who are currently up to date on their vaccines. But we assume that most of that is probably because children 5 and older are now able to get boosted. So children 5 to 11 were not able to get boosted before, and they can now. And we're going to talk about that. And also, there's a much slower rate of people getting boosters. As you all know, folks are sick of it. And we are definitely seeing people not get boosted at the rate that we saw people getting vaccinated. And again, with these new variants being so contagious, it is critical that people get boosted. So of people eligible, the rates are a little bit higher. So you'll see about 93% have started their series, about 86% have completed their first series, and then 52% have done their series and have been boosted, and then a little over 58% are up to date, meaning that there are some folks who maybe got a first booster, but they're also due for a second booster, and so they're not, and they haven't done it. So questions on any of this?
Yeah, there's a question in the chat box. If a person was vaccinated originally with Johnson & Johnson, are they no longer considered fully vaccinated? Thinking of the vaccine mandates for some employee groups.
So for folks who got Johnson & Johnson, the recommendation is to get a booster at 2 months after. So that's much sooner than Pfizer and Moderna. And it is recommended that they would get either a Pfizer or Moderna booster. So they are considered vaccinated, but not after, after 2 months, they would want to go get, which is a pretty quick turnaround. They would want to go get Moderna or Pfizer instead of Johnson & Johnson. I do have a slide about that. Let's jump to it real quick. Where is it? Made you all sick there, didn't I? But the reason why Johnson & Johnson is no longer recommended for either initial dose or boosters is, one, we're finding that it's not providing as good of protection against these new strains, and Pfizer and Moderna have fewer risks involved, including Johnson & Johnson has a low risk, but it's a serious risk of blood clotting disorder, and especially for women under the age of 50. So Pfizer and Moderna have fewer risks involved, and they have much greater protection. So sorry, I'm going the wrong direction. Going back. All right. So if somebody did get Johnson & Johnson, they just 2 months later want to go and get either Pfizer or Moderna. Make sense? And then a question in the chat, how soon after the initial first booster shot are you supposed to get the second booster? And is everyone supposed to get a second booster, or is it still only for certain groups? Awesome. I'm a visual person, so I'm just going to keep going to the slides. I have them in writing. So first booster shots are recommended for everyone now over the age of 5, and I'll go back to that because that's new. But they're recommended over the first booster, everyone 5 and older. 5 months after Moderna or Pfizer, 2 months after Johnson & Johnson. And for folks who are immunocompromised, again, a reminder, their initial series would have been 3 shots. So the Pfizer or Moderna regimen, and then 4 weeks later, a 3rd shot. And then 3 months later, for folks who are immunocompromised, or meaning their immune system is weakened either through an illness or through medication that they're on, they would want to, it's actually sooner, it's 3 months. And then the second booster shots, the CDC just, their messaging was a little nebulous before. So they have strengthened their messaging, and before they were like, well, you can get one, and it was confusing everybody. So they've come out and said that it is recommended. Again, I want to make sure I didn't say this in the beginning. I'm not here to tell you to get vaccinated and boosted. It's totally up to you if you decide to do it. I'm just letting you know the recommendations. So I just want to put that out there right away, because yeah. So for folks who choose to get boosted, the second booster shot is recommended for people. And again, now it is recommended. It's not like you could or couldn't. It's recommended for people who are 50 years or older, for folks who are 12 years and older and moderately or severely immunocompromised, and 18 and older who received Johnson & Johnson for their first primary dose. So they would, for Johnson, if going back to that initial question, if someone had received Johnson & Johnson as their initial dose, 2 months after that, they would get a first booster, and then 5 months after that, they would get the second booster. Unless they're immunocompromised, then it would be 3 months, and then, 4 months after that, they would get the second booster. Did that, I want to go back up. Anna, did that answer your question? Cool, awesome. All right, and then, yep, so there's another question on the chat about 5 to 12-year-olds now being eligible to be vaccinated, and the answer is yes. And I'm gonna go back to where we were, and then we'll hit that in just a minute. And I am going the total wrong way. Sorry, y'all. Don't mean to make you dizzy. All right. So again, a reminder that you are going to see people getting COVID. When people say, why do I need to get the vaccine? Everyone I know has had COVID, and I'm not vaccinated and I haven't had it. The reason why people do want to get vaccinated is, if they choose to get vaccinated, is that the vaccine, and specifically Pfizer and Moderna, are good at protecting people from getting seriously sick from COVID, hospitalized from COVID, dying from COVID, and getting long COVID. So most folks, when they're up to date with their vaccines, if they get COVID, they're going to most likely get a mild case of COVID. They're not going to be hospitalized or die. And that's why we are seeing those low rates. Does anyone have questions about long COVID? I know we talked about this last week, but if checking in to see if anyone has questions about long COVID. These are the awkward silence moments when I wait for people to like type or unmute. All right, if you do, go ahead and ask me. So to compare, oh, yes, cool. Someone asked, what is long COVID? So long COVID is when somebody gets COVID. A lot of times people are going to recover within a couple weeks or a few weeks. Some people end up being seriously ill and hospitalized, but then they recover. And long COVID is when people are experiencing pretty serious symptoms of COVID, or actually of long COVID, for longer periods of time, and even like a year or more. Some of those symptoms are memory loss, and I know we're all in a memory loss state right now with COVID, and I know my days feel like Groundhog's Day, and I'm like, I don't remember, but it's different. It's like they call it sort of like a brain fog, and it's similar to dementia. It also can cause long-term lung problems and heart problems. So I know for me, this is the thing that I'm most terrified about with COVID. It's not like this short illness, or I'm boosted, double boosted. So it's more about not wanting to have these long-term symptoms. Also, I've talked to so many women who, you know, as I do this education all the time, and they tell me they had COVID and, you know, they can't remember anything and they feel all foggy, and people keep telling them, oh, they're crazy. So I'm here to tell you, you're not crazy. It's real. The rates I've seen are really different. You know, I think the CDC says 10 to 30% of people who get COVID get long COVID. I've seen other studies that say much higher. So I think the CDC rates are a little bit low. But that's not my opinion. It's just there's different studies out there around it. And then Sasha, if you have more questions about it, please ask. Is the definition of fully, sorry, I'm reading another question in the chat. Is the definition of fully vaccinated still just the 2 shots, or does it now include the booster? So now that, again, like sort of one of the changes, I know it says fully vaccinated here, because this one goes through fully vaccinated, boosted, and then fully vaccinated, not boosted. So the ideal for folks who choose to get vaccinated is that they are up to date with their vaccines. So, and we really need to, we've been trying to change the terminology a lot, but so there's the initial series, and then when people are due for their boosters, they would get their booster. And if they are eligible for a second booster and they're due, they would get that. So to be fully like up to date with your vaccine, you would need to be getting the booster when it is time to get it. So I hope that makes sense. So fully vaccinated people are still talking about as the initial series, but that does not mean they're up to date with their vaccines. All right, so this slide is a slide I always show that basically says that yes, vaccines and boosters do help prevent death and hospitalization. So when folks are not fully vaccinated compared to folks who are up to date on their vaccines, they're 1.2 times more likely to get COVID. If they're not fully vaccinated, they're 7 more times likely to get COVID than folks who are up to date on their vaccines, and 13 more times likely to die from COVID than folks who are up to date on their vaccines. I hate fear education. So this is not about fear education. Fear education does not work. You can't scare someone to go do something. This is really just to show you the difference between folks who are vaccinated and boosted and up to date in their vaccines and folks who are not, and that the vaccines are effective. And they have been shown to also be effective against Omicron and now BA2. So a lot of times I have questions like about the different strains. So the first strain we had, Alpha, we're going through like the Greek alphabet, you know, all the way through. But the first strain, Alpha, we had the most effective vaccines we ever had. Now with BA2, they're not the most effective vaccines we've ever had, but they're still really good and really effective. And it is really important for folks to get boosted. And especially thinking back, you know, the reason our death rates were so high in the beginning, before we had the vaccines, were among folks who had underlying health conditions. And so we saw Black, Indigenous, and Latinx communities hit really hard with COVID because of racism, and racism causes underlying health conditions. We saw LGBTQ communities hit really hard, although we don't have a lot of great data because if you ever went and got tested, you might remember you weren't really asked those questions. But again, because of the underlying health conditions and then folks with disabilities, also were hit really hard. And so the first tiers of folks who were able to get vaccinated were elders and folks with disabilities and folks who had underlying health conditions. So if those folks have not been boosted yet and they got vaccinated way back then, please let them know that they are due for their boosters. Before moving into this, I want to say, I know people are so sick of COVID. I mean, you can even see by the number of participants we have. I know it's a sunny, beautiful day, so that could be it as well. But also about a month and a half ago, the participants on this call were double. So I know people are so tired of it, and unfortunately, it's not going anywhere. So, and it's more likely to go away. Well, one, the more we can globally vaccinate, and also you hear my rage and rant about global health every meeting, and also that people continue to do the boosters when they're eligible, because that will limit the amount of virus spreading in our communities. All right, so somebody had asked, had not heard yet about the, oh, that sounds shaming, I don't mean to shame, had asked about folks 5 to 11 being able to get boosters now. So, yep, they are. So now, children 5 and up, or everybody 5 and up, can now get booster shots. The reason why someone would want to get a booster shot is, again, we want to make sure that their protection continues. And over time, the protection does fade. And again, especially with these newer variants. And so it really is important to keep your immunity level up through the booster shots. And they have been shown to be extremely effective and extremely safe in children 5 and up. And they have prevented, and they prevent serious illness in children. I know sometimes people say like, oh, well, kids don't get serious illness, so what does it matter? And unfortunately, you know, not the rates of serious illness among children are lower than adults, but that doesn't mean they don't get them. And so we do know that children have been hospitalized, have died. We definitely saw that under Delta, which was much more serious for children. But children are not immune to getting very sick as well. So that's why the boosters are important. Also to protect our community and keep the numbers down in our communities. If anybody has kids in school right now, you see what's happening in school. So lots of kids are getting COVID. My brother's whole family just got it because my niece got it from school. And yet no one had reported that they had it to the school. So, so yeah, super important for kids to maintain being protected.
Hey, there's a question in the chat, probably to me, Becky, but I think it's circling back to the other question. But can skin rash be long COVID-19? My daughters didn't give up on itching their stomachs, legs, and arms after being exposed to COVID-19.
You know, that is not one of the symptoms that I'm familiar with. And if you want to privately email Sealy, I can send that question up through the powers that be, but because I never want to invalidate somebody and say like, that's not real, but that's definitely not one of the symptoms I've heard of for COVID. Usually symptoms of COVID are going to be flu-like symptoms. Children often get like more stomach illnesses and throwing up and fevers and things like that. If their rash was induced by the fever, that could be something, but I haven't heard of people getting like rashes or itching. So for that, I would say that you'd want to talk to talk to a healthcare provider, or talk to your children's doctor. And if you don't currently have a doctor, we have public health centers throughout the county, and we have that can see them, and it would be free or low cost. So if you need a healthcare provider, Celia, I don't know if you wouldn't mind finding the link to our clinics and just putting it in the chat, and that way folks can find it. And Willie, you just said when you were doing contact tracing that rash was a symptom. However, yeah, can you tell me about that? Because that was definitely not one that I have heard about. So would you mind unmuting and letting folks know about that?
Sure. I was part of some of the initial programming for contact tracing, and rash was one of the symptoms that we were asked to identify as part of that process.
Okay. Yeah, that's interesting. So yeah, I would definitely, and again, that's not on the list for like long COVID either, but that doesn't mean it wouldn't be. So I would highly recommend talking to a healthcare provider about it, because there are medications and treatments, for things like rashes. So, and again, if you do not have a healthcare provider, we do have free or low. Here's the thing I love about public health. I say free or low cost, but one is someone doesn't have insurance. We have folks at all of our clinics who can get you on insurance. And if you see one of our doctors and there is a bill and you can't pay it, you just don't pay it. We never send to collections, and we never send bills. So this is one of the things, and we see everybody. We always have interpreters, whether they'll be either on the phone or in person, and we will see everybody regardless of like immigration status or anything like that. So I know we are government, but we also would never call, like, if someone is not a U.S. citizen or they're not in the U.S. in the ways that the U.S. wants them to be here, we would not call, to have them deported or anything like that. So I just want folks to know that we are a place that they can come. Willie, thank you for that information. And that was probably a longer answer than the person was wanting, but definitely would want her or their children to go ahead to have a medical provider look at it. So I think I think we talked about these as well. And then again, just a reminder, COVID isn't going away, and vaccines and boosters are the best protection available, and will help young people be able to do the things, the activities they look forward to doing in the spring. I don't know what that end is. Let's see, did I have something else there that I'm blocking with my cute picture of those cute kids? Oh, and summer, ta-da. The other thing is, again, it protects our communities, right? Again, it's going to keep the rates low in our communities. So the less children who get it, the less elders who get it, the less 30-year-olds who get it, just the less COVID there is in our community spreading. And then we already, yeah, I think we already talked about this because there was a question in the beginning. But just a reminder, so my mom is immune compromised. She went to get her third shot, and then she went to get her booster, and they told her she couldn't get a booster because she already had one. So a reminder, that third shot is not a booster for people who are immunocompromised. That is part of their initial series. and that is to get people who are immunocompromised at the same level of protection as people who are not immunocompromised. And then 3 months after that third shot, they would still get a booster. So people who are immunocompromised are going to be getting more shots and more doses. And you can imagine how badly I wanted to call that pharmacy and tell them how wrong they were. Yeah, so Karen, you said people are immunocompromised may also be eligible for Evusheld. So we talked about Evusheld last week, and I'm happy to send out the slides about that. But just as a reminder, Evusheld is, I don't even know if I'm pronouncing it right. So Karen, if you've heard it said out loud, let me know. I've only seen it in writing.
That's what I've heard too.
Okay, great, thanks. Evusheld is not in place of a vaccine, so people would still get vaccinated, but if they are immunocompromised and at risk of getting, severely sick with COVID, or there's some reason they can't take the vaccine or get the vaccine, Evusheld is a medication that is 2 shots, and those 2 shots are 2 different antibodies, and it's what we call pre-exposure prophylaxis, which what that means is you're getting the medication before you get exposed to the virus. So you get it, if you're already vaccinated, you have to wait 2 weeks before getting it. For folks who are pregnant or breastfeeding or want to get pregnant, it's really important to know there's been no research done on fertility, on safety around pregnancy, and on breast or chest feeding with Evusheld. So it's something, if it's a drug that you feel like you need, and you're one of those things, wanting to get pregnant, not wanting to be infertile, or you want to, you're breastfeeding or chest feeding, again, it's something you'd want to talk to your provider about. The injections are antibodies, so, there's not really a reason that, like, scientifically I could think of that would be an issue, but they haven't done the research on it yet. Karen, is there anything else you wanted to say about Evusheld?
Just that I've heard that it had been, and then some states are reporting a lot of difficulty getting it, but that's not true in Washington. So if somebody thinks that they're eligible, they should definitely contact their provider, because you do need a prescription. It's not we at the county are not providing Evusheld. This is something that would come through a medical provider.
Yeah, thank you. And again, I can send out the slides from last week because it explains how to get it and all the information on about the drug and how to get it and when to use it. So I just said it, but sometimes it's easier when you can see it. So so I can send that back out. And then, oh, Kathleen, thank you for putting this in the chat. We do have amazing community health access program, which is a super amazing resource for folks to access health insurance. And those are actually the folks who are at our clinics. They work for that program and they're at our clinics. And they also are go into community and help people get signed up for insurance, like if they're invited into a health fair or something like that. And they are an amazing group of folks here at Public Health. And then a reminder that the vaccines, the boosters are free, no insurance is required. You don't have to be a US citizen to get it. And the booster shots are the same Pfizer vaccine as the first 2 doses of Pfizer. The only reason I mentioned Pfizer is because this is for 5 to 11-year-olds, and the only, just in case you forgot where we're at with the side stuff we did, but Pfizer is the only currently the only vaccine that's available for people who are under 18. So that's why I mentioned Pfizer. And then we already did this reminder of like when to get it. And again, I'm going to send this out so you'll have it all in writing and you don't have to go find it, but you can go find it on our website and you'll have the link. And just a reminder, again, for folks who are immunocompromised, that the recommendation for the booster shot after Moderna and Pfizer is actually 3 months versus 5 months for folks who are not immunocompromised. So that's super important. And we already did this reminder about Johnson & Johnson because they had questions on it. So we do not recommend it anymore, and we recommend Pfizer or Moderna. I know some people got Johnson & Johnson because it was sort of the more traditional vaccine versus the mRNA vaccines. So a reminder, Pfizer is actually FDA approved for folks over 18, if that matters to people. Also, mRNA technology is not new, and we have a lot of evidence of how it works in the bodies, and it's not going to change your DNA or anything like that. So they're super safe, they're super effective, and once they're in the body, Johnson & Johnson and Pfizer and Moderna actually work really similar in the body. They're just different technologies. And then where can people get their booster? I'm going to show you where in King County we are doing them in just a second. But just a reminder that not all healthcare providers and not all like pharmacies might be set up right away for 5 to 11-year-olds because it's new. So they just might not be ready for it, might not be set up for it. Again, I'll send this out, but I'm going to remind folks that the website to go to for pharmacy and other locations is vaccinelocator.doh.wa.gov, and that is available in over 30 languages. So there's a language menu on it. I will also show you in a little bit for folks with disabilities, if you need specific requests, how to access them. It's not on this slide, sorry about that. So Auburn Vaccination Site has already started doing these boosters for over 5, people who are over 5. And the Eastgate site, which is in Bellevue, has started doing them already as well. And then again, there's a link for other vaccine locations. If you go to Eastgate, tell them all I said hi, because that's where I worked for the last 15 years before COVID. They're wonderful. Actually, I started in Auburn in 2001, so they're both great locations. And then here's what I promised to share. So if you would like to make an appointment at one of the sites, you can call, and again, I'm going to read this for the interpreters, our King County call center, 206-477-3977, and it's every day from 8 to 7 p.m. If you need a specific language, let them know the language that you need, and they'll connect you to our language line. The nice thing is you'll get a person. You're not going to get like a recording and have to like press buttons or whatever. You'll get a human. And then if you have a disability, you need a specific accommodation, you would call 206-477-3977 or email publichealthaccommodations@kingcounty.gov. Questions?
There's none in the chat box to me personally.
All right. I will also say that this Eastgate Center has dental and primary care and pediatricians or doctors. So they have regular doctors, they have doctors for children, and they have dentists. And they also have those folks who can get folks signed up on insurance. Anyone interested in requesting an in-home vaccination for someone who is homebound can call the PIC. Yes. So we do vaccines. Thank you, Karen. We do, and the PIC, sorry, for folks who don't know what that acronym is this phone number. It's this King County call center. So 206-477-3977. So we have been, at the county, have tried to make the vaccines available in many, many different ways. We do vaccine events in community. We have multiple teams who do that. So you can actually go onto our website, and if you just Google King County COVID vaccines, you can find a link to where to request. And if you can't find it, you can email me. I'll put my email in here. You can request a link and for a vaccine event to happen at like your church or mosque or organization. And we can also provide more housing site. And we can also provide education beforehand. So my team or my program, we have folks who can present in or with my colleagues in Spanish, Oromo, Amharic, Somali, Arabic. I know I'm missing something. And we also have 2 young people who provide education to other young people. So again, I put my email in the chat. You don't have to fill out the form that's on the website. If you work for an organization or, you know, or a business and you want education for your clients, for your staff, for your whoever, you can email and we can provide that education, and we can also get you that COVID vaccine event link as well. All right, I haven't even looked at the time. Where are we at? Oh, I'm not doing too bad. Okay. And Lena, who just said thank you in the chat, deserves 5,000 thank yous, because Lena is amazing and provides wonderful support and education in English and in Dari, and it's phenomenal. So I'm always going to rave about you, Lena. All right, so what's the vaccine status for 6-month-olds to 4-year-olds? This has been confusing this week. It's coming. The vaccines are not yet available. That's been the part that's been confusing. People have heard like snippets and thought they were available, but Moderna and Pfizer, again, a reminder, they work really well at preventing severe illness, hospitalization, and death. So what we're also finding, though, is that they are working well to prevent kids from getting COVID as well. But if kids get COVID when these vaccines become available, they are also really great at preventing them from getting severely sick. Pfizer, last week we talked about Moderna, and I brought that with me this week too, just because it's part of the whole picture. So both Pfizer and Moderna has already applied to the FDA for emergency use authorization of their vaccine, and Pfizer is seeking emergency use authorization to vaccinate 6 months to 5 years, 5-year-olds. The Pfizer, so Pfizer originally was going to put their application in February, and they asked for a hold because they wanted to look at their data, and their data showed that it was about 30 to 40% effective at the time, and so they were thinking that maybe a three dose vaccine would be better, and they were right. So the vaccine dose that they would use for 6 months to 4 years to 4-year-olds is 1/10 of the dose that is used for adults. And it's a 3-shot series. I couldn't find the information about how far apart those shots are. They're going to be releasing their data soon, so I'm assuming that's when I'll find out. But if somebody on the call knows, I couldn't find it. But it's a 3-dose series of shots, 1/10 of the strength that it is for adults, and it was found 80% effective in preventing COVID among children who were 6 months old to 5 years of age. So again, no vaccines are 100% effective. So this is a really highly effective vaccine. Reminder, flu shots, usually 50 to 60% effective. It's also important to note that this study was happening during Omicron. So which means the study was happening during a time when we had an extremely contagious variant. So it is effective against these new variants. And they're continuing to look at it with BA.2 as well. There were no safety concerns. Nobody got seriously sick from, or there were no safety concerns that came up in the studies with children. And Pfizer is going to submit their data this week to the FDA. Questions about Pfizer for children before we talk? I'm going to do a quick reminder about Moderna. All right, Moderna has already asked for FDA approval, emergency use approval. The FDA was waiting to do them both together. So this vaccine is a 2-dose vaccine. It is also a lower dose, and it was shown to be 51% effective. I gave a different number last week because there were 2 numbers floating around. So I went and looked at their study, and their study had it at 51% effective at preventing children from getting COVID who were 6 months to less than 2 years of age, and 37% effective at less than, for those who are 2 to less than 6 years. So they actually went up to 6 years of age. These numbers were lower than they expected, but again, the study was conducted during Omicron, so that's important to note. And none of the children who got COVID during that time, who were vaccinated, got any severe illness. So again, it was effective against both protecting from COVID, but it worked really well in protecting against severe illness. Questions about this? And again, the FDA was waiting for whatever reason to consider them at the same time. So they are going to be meeting in June and looking at both Moderna and Pfizer and deciding whether or not they will allow these for use in the US. Questions? I also want to remind folks who do have kids who are, under 5, if you are breastfeeding or chest feeding, or if you are pregnant and get the vaccine, you will be sharing your antibodies with your child. So there's a lot of really bad myths out there, and we talked about pregnancy and COVID and the vaccine last week. So I won't go into a million details, but for folks who are breastfeeding and chest feeding, and they want to protect, or chest feeding, and they want to give their child some protection against COVID, themselves getting vaccinated will do that. There are no negative effects from that to the child, and there are positive effects in that you will be sharing your antibodies, which give them some protection. It doesn't, again, it doesn't take the place of the vaccine, but it does give protection to children. And like I said last week, I have no judgment on folks who are going to be chest feeding or breastfeeding for 6 months or 5 years. So the nice part is they'll be getting some protection from your vaccines and boosters. All right, questions on any of that? All right, do people want to talk about monkeypox? I brought it with me because, you know, it's a thing I thought I was going to get questions on. So give me some, I'm going to open this up. Yes, please, monkeypox. Okay. There are no pictures here because I, you know, in doing my research, decided no. So I want to start with, like, what is monkeypox? So monkeypox is part of a group of viruses. There's 4 of them, and it is similar to smallpox. So it's a rare viral illness in the U.S. It usually begins with symptoms that are similar to a flu, including fever, headache, muscle aches, chills, exhaustion, and swollen lymph nodes. It then progresses to a rash on the face, hands, feet, and eyes, which you can imagine with the face, hands, feet, the similarities around smallpox, and sometimes people think it's smallpox. Also mouth or genitals, and they can turn into raised bumps and blisters. Yeah, so sometimes people actually think it's an STD if they're getting them on their genitals, or getting bumps and blisters, or cold sores if they're getting them around their mouth. So it is important right now, if folks are experiencing, in general, if you have blisters on your genitals, good idea to go get that checked out. So don't Google it. So for 20 years before doing COVID, I was a sexual health educator. So I didn't say that before, I'll say that now. So yeah, don't Google it. Everybody who Googles things, they would come into the clinics and be like, think they were, either thought they were dying or thought they were fine, or thought they had whatever. So get it checked out. And then most people recover in 2 to 4 weeks. But unfortunately, the disease can be really serious for people who are immunocompromised, for children, and for pregnant people. It says women, sorry, for people who are pregnant. And the reason for people who are pregnant is because their immune systems are already taxed from the pregnancy. So the virus does not spread easily between people. It's not like, flus and colds. One, it has to enter the body through like an opening. So either like broken skin or the eyes, nose, or mouth. It's usually passed human to human by large respiratory droplets. So I'm just going to say spit and snot. I love the term respiratory droplets, spit and snot. And the difference between COVID and monkeypox, COVID are usually smaller droplets, or both smaller and larger droplets, and this monkeypox is large droplets, so they fall pretty quickly when they're large droplets. So that's part of why it's harder to get, because you have to have closer contact, and it has to be a little bit more like longer contact with somebody. It's not a sexually transmitted disease, but it can be spread through sex, because again, there's longer contact. All these commentary out. And if someone has like a rash, an active rash, while having sex, or they're exchanging spit, right? And sometimes not, it can be someone can get it through sex, but it is not considered a sexually transmitted disease, because you can get it other ways as well. And then you can also get it through like direct contact. Like if somebody has monkeypox and you're sharing a bed, or you're sharing clothes or sheets, you can get it through their clothes or the clothes and the sheets or the towels, again, through the eyes, nose, and mouth or broken skin. Yep, so the comment in the chat is they saw a post that there is a case in King County. So that's why we're talking about it, absolutely. And I'm going to get there next. I just wanted to explain what it was first. I couldn't decide which order to do it, but I figured if people are like, what the heck is monkeypox anyway? So I figured I should describe what it is first, and then we'll talk about that case. So thank you for bringing that up. Usually where monkeypox is found is in Central or West Africa. And people can get it through these same ways that we already talked about. They can also get it from bites or scratches from specific rodents or mammals. There hasn't been what's the word I'm looking for? It has not been exactly decided which rodents and mammals. So that's why I say small rodents and mammals, because they're still trying to figure out which animals pass it and which don't. It can also be passed when preparing like wild game, like for food, right? Or having contact with an animal that is infected, or possibly through the animal products, like eating the animal products that they weren't cooked, or yeah, and that animal had monkeypox. So again, this is a human-to-human transmission, and this slide talks about how people would get it from animals. And again, we don't usually see it in the U.S. The person, so there has been a case that has been shown to be positive. So again, monkeypox is part of a virus that has 4 different viruses, cousin orthopox virus. So there was confirmation that this person had an orthopox virus. Washington Public Health, like through the Washington Public Health Lab, Public Health and Department of Health are working on this. It has been sent to, that sample is sent to the Center for Disease Control just for confirmation that it's monkeypox. The one person who was that person who was tested and shown to be positive with this virus is in isolation. So they're not posing a threat to other people. And they're also under care. And they're also, you know, we do contact tracing, not just with lots of things. We've done them for STDs for years. We were doing it with COVID. And so this person, we're also doing contact tracing to, meaning we are tracking down the folks that this person could have possibly given monkeypox to make sure that they are also going to be isolated and treated. So public health is on it. I don't know if that makes you feel better or not. Department of Health is on it. There is also medication, and the smallpox vaccine does work. I think I read it was 85% effective against monkeypox. So I know folks are really concerned about monkeypox spreading. There's also, oh, is there a question? Oh, nope, okay. There's also a lot of conversation about certain communities being at higher risk of exposure. So the reality is anybody can get it. It's not about a person and their group, it's about what they're doing and if they have it. So I'll just read this quote from Dr. Duchin. The public and healthcare providers should be aware of the growing international monkeypox outbreak. At this time, we have no evidence that monkeypox is spreading locally, but if there are unrecognized cases, that's a possibility. People should understand that the disease can affect anyone, and those who are most at risk are those who have had close physical contact with someone with monkeypox. And again, right now, we have the one person and we are contacting the folks that he could have exposed. So anyone who has the symptoms that I just mentioned of monkeypox should be evaluated by a healthcare provider. And again, if you don't have a healthcare provider, we do at Public Health, and we can, and we can see you for your low cost. And again, we never send bills or collections, and our doctors and healthcare providers are great. But again, just a reminder, one case so far here in King County, and that person is being isolated. So I just didn't want, there's so much going on in the world. I really wanted to like maybe help calm this down just a little bit, because we all have enough going on in this lovely, lovely world. Are there questions for me though about monkeypox or COVID or anything like that? Or the new doses or vaccines for children or pregnant people? All right, you can please put them in the chat or unmute and ask me. I do want to show you, I never have time to show you resources, so I'm super excited I can show you resources. I did mean to bring we do have community vaccine events happening out in the community. I meant to bring those with us, but you can find them on our website. Celia, I don't know if it's possible for you to just pull that website out and put it in the chat. But
what website? What website is that?
The King County community vaccine events that are happening out in the community.
Okay.
And then also if you could also put the link to if people want to have an event at their church, mosque, synagogue, organization, business, if you could put that link in there too, that would be really helpful. Excuse me. Bubbly water while presenting, yay. Sasha, yes, we will send this out. If you are not on the list, I'm gonna put my email in here again. You can email me. Like if you don't receive reminders or you don't receive after the calls, usually within a day or
Suite à
so.
l'appel, dans un jour ou deux.
Usually a day or so, it might be a little bit longer this
Un
time.
jour ou deux, peut-être un peu plus.
Hey, Louise, we can hear you
Eh
in the
bien.
English room. Did you have something for us?
Excuse me, the room got changed. I'll go back to French.
Sorry. Thank you. I do love hearing you talk French though. It's very pretty. So yes, Sasha, if you are not on or anybody here is not on the email list, we send out not just this email, but anything else we promise. Like we'll send out the last week's one as well. So you'll have the Evusheld information. So in terms of community resources, there's an event tonight, so that I'm glad I got to get to this, through the Immigrant Women's Community Center, and they're phenomenal if you do not know them. And they have a presentation tonight that is about caring for youth and their mental health from 6 o'clock to 7:30, and they're going to have interpreters. So this obviously has in English and Spanish. They're also going to have interpreters for traditional and simplified Chinese. Thank you, Celia, I appreciate it. And for Pashto and Dari. And Lena, if you want to get this out quicker, oh, I sent it to you, never mind. I was going to say, because it's tonight and we're not sending it out tonight. And then also in Arabic, and Intizar, I think I sent this to you as well. If I didn't, let me know and I can, but they will be interpreted. And then I send these out every week. We have a call in Spanish that is really done by two really amazing colleagues of mine. And I don't read Spanish, so I cannot remember the day. Gina, are you on here?
Yes, I am.
Can you tell people what day and time? And I don't remember if you're doing it weekly or bi-weekly right now.
Yeah, sure. We meet we meet the first and third Tuesday of every month. So next Tuesday, folks can join us at 5 p.m. We'll be live streaming via Facebook through Condado de Quin, and you can also join us via Zoom. Thank you for including that, Becky.
Right, so it's every other Tuesday, and you said it was which Tuesdays of the month?
It's the first and third Tuesday of every month.
Thank
So
you.
next Tuesday, we'll be meeting.
Great, awesome. So first and third at 5 p.m. And I'll send this out so you'll have the links. And then we talked about this event last week, but then again, it hasn't happened yet. So I brought it again and want to show it because it's tomorrow. So a Pacific Islander community conversation with amazing experts to talk about the boosters and mental health, Bible and vaccines, and dispelling myths in the community.
Yeah, I'll be actually facilitating that one, Becky.
You want to talk about it?
Yeah, we just this is our community conversation part 2. We had a part 1. It turned out really good. We had about 200 plus folks show up and ask their questions. And you know, it's always good to talk story with folks from your culture who can identify from your cultural background. So it's actually it was pretty fun. So if you know any Islanders or if you just want to come, yeah, please join us. Thanks.
Thank you. I just put the link in the chat because again, I don't know that this is going to go out in time. So again, it's May 26th. So tomorrow night from 6 to 7, Silly is amazing. And I'll tell you, I heard amazing things about the first event. So, yeah. And then the other ones I will go ahead and send out. There's, we already talked about some of these on here. So we will send them out and you'll have them, all these other resources. But I wanted to make sure to talk about those ones since they're coming up before these are going to be sent out. All right, and I'm happy to go back to one if people need more information about it. Let me know, or if you wanted to read it, because I went through these quickly, or if folks have any more questions for me. All right, I do want to remind folks, I do trainings, education, Q&As with groups and community agencies, training of trainers. And then we have a wonderful team of folks who can do, again, trainings or Q&As in different languages as well. And if we don't have the language you need it in, we will hire an interpreter to interpret. I mean, obviously, it's nice to have it done in language. So also, if your organization would like to be trained, one of the things I love is I trained an organization and they actually do this presentation another night for their community in other languages, and I love that. So I put my email already twice in the chat, but I'll do it again, and you can just directly email me for a presentation, a trainer. If you're looking for a COVID vaccine event, that link is in here. I don't do that, but I can help provide education beforehand in many different languages. So that is it. All right, any last questions for me? You guys have been quiet the last 2 weeks. All right. The only last thing I will say is I looked, I read the studies for the vaccines for children and the safety profiles of them, and the safety of the vaccines for 5 to 11-year-olds, there was really good, and the symptoms that folks had that were vaccinated were the same symptoms that folks had that received the placebo or who weren't vaccinated. So they were, it was great to see how safe they were. All right, well, so I don't usually do this part about the date of the next one. I'm trying to get my computer to turn off the next. Okay, and our next one will be June 8th. And we will wait, there's something in the chat. Thank you, Derek. I saw that you came in and I was happy to see you. All right, well, so the next June 8th is our next meeting. And so we will see you all then, and then we'll send this out as soon as we can. All right, everybody have a nice night. And Celie, thank you so much for jumping in. I really appreciate you. That was like well above and beyond. So thank you. And thank you to all the interpreters. You all are incredible.